going to start an IV on you. Your vital signs look okay right now.
60 seconds.
That day started like any other day. Home with my family. Went upstairs and knew something wasn't right. Told my husband I had chest pain and I knew that I needed to get to the emergency department right away. Called 911 and they were there immediately. From the time I got symptoms, I knew I didn't have a lot of time left and I knew I needed to get to the emergency room right away. Knowing Garnet Health was just around the corner made me think everything was going to be okay.
It was a Thursday evening, and I just didn't feel well. I couldn't get comfortable, and I went and sat on the couch, and I started to vomit. So my husband right away called 911, and then the ambulance got there and brought me here to Garnet Health. It was such a busy evening in the emergency room, so I was in the hallway for a little while.
When the ED has more space, it flows better. I recall going back to the days of Horton. Horton was a very tight emergency department, and it was difficult. It was difficult to maneuver. It was difficult to get patients through.
Some people may come in as coughing, and you think, okay, they just have a smooth little cough, but they're having a major heart attack, and we need to save their heart right now.
Having our emergency department grow and expand will definitely bring a better experience to the patients.
With Garnet Health Medical Center's expansion of the emergency room, it's really a great opportunity for Garnet Health doctors to collaborate, particularly as we see patients in urgent care, many of whom require a higher level of service, and being ensured that there will be a place for them in the expanded emergency room will certainly help speed their chances of being seen in an appropriate time.
Every minute counts in the emergency department because whether it's dealing with the heart or dealing with the brain, we have a saying in the medical field that time is muscle or time is brain. So the longer it takes to treat someone to know what's wrong with them, you could be losing heart muscle, you could be losing brain function.
And now they talk more and more about the platinum. 10 minutes, the first 10 minutes are the most critical. That's why the trauma surgeon, all the care has to be delivered as soon as the patient arrives in the emergency room. In trauma care, every minute counts.
From the time that we arrived in the emergency department, the patient-centered care, the skilled physicians and nurses reassured me that everything was going to be okay. So from the time I arrived all the way to the cardiac catheter, I was pretty scared, but I also knew I was where I needed to be, in the place I needed to be with the best care that we had in our community. I was very fortunate that day Garnet Health was there.
So the earlier we can get a patient in, the sooner we can save them, give them life-saving interventions, medications that are in a specific time period, or just, artificial airways, anything that can really help the patient long-term.
Every minute counts. I live in this area, and this is the emergency room I bring my family to. What a wonderful opportunity to expand the services of this emergency room and provide better care for my family.
Once I went into the cath lab, they started the procedure and I suffered cardiac arrest. And the doctor said he had to paddle my heart upwards of 50 times to get it to beat normal again. And they placed the Impella heart pump up through my groin into my heart, and I woke up 12 days later and I had the LVAD. It was called a left ventricular assist device. It goes in through your abdomen and up to your heart. And I had that for 13 months, and then I had a heart transplant. Garnet Health saved my life.
If it wasn't for them, I wouldn't have been here today. I wouldn't have seen my grandchildren grow up and have that experience. I will be forever grateful that we had that in our community.
So depending on the nature of the illness or the injury, depends on which hospital we transport to. With Orange Regional being now a level 2 trauma center and a cardiac center, a PCI center, the patients coming here, it's that much quicker to get care. The quicker the vessel opens up, the better chance they have of survivability.
What the expansion means for me as a paramedic is that I will be able to discharge my patients and provide them with definitive care quicker.
With the ER expanding, it's a beautiful thing because in the urgent care, we see a lot of patients for lower acuity or lower urgency problems. And we do really rely on the emergency room to help us when we get some of those more difficult cases coming in.
The emergency department is the front door to the hospital. And some people's first experience with Garnet Medical Center will be in our emergency department, and we want that experience to reflect all the quality work that goes on in our organization.
From the inpatient side, the expansion of the ED means that we'll be able to get those patients in the hospital quicker. The time from the ED to the inpatient side where they can actually get, the proper treatment and everything that they need in order to get better, I think will be enhanced by the expansion of the ED. Moving people quicker through, getting them into the hospital and getting the treatment that they need, I think will be great for our community and for our patients.
It's a few days before Christmas, and a gentleman came in shoveling snow. He was probably in his 60s, almost 70 if I recall. Active guy, sat in his truck and just kind of died in the truck. EMS did a fabulous job. They got his heart rate back, got a pulse back, and then we did our whole thing. We had a code IC, we intubated him. On Christmas, he walked out.
There's always, a feeling of pride that people recognize Orange Regional and, talk about their family's experiences here. And it's important that we can meet the needs of the community and not have to have people travel to New York City or Westchester County, that we can offer this amazing care for our community right here.
I'm a trauma nurse, so I live and breathe trauma, and it's very important that we are able to provide that level of service to our community. The closest is not that close. So for them to just bypass us and go somewhere else doesn't provide care to the community, and we're able to take them to OR faster if need be. We're able to get them home faster if they need be. So it's very important that the trauma program is here to provide that care to the community.
In the emergency room, you see so many different people, and I had this one woman in particular. Her fiance actually abused her. And she came into the point where you couldn't even recognize her. And I kept asking her, because you can report to police, but I asked if she was safe. And she kept saying, no, I'm fine. And I said, I'm gonna keep asking if you feel safe until you leave here, because I want you to feel okay. So eventually, I asked her multiple times, and on maybe the third try, she said, yes, please, call. So we eventually did that, and she came back probably a month later. Beautiful woman, didn't even recognize her. And she came with a rose bush to give me, and she said I saved her life.
People ask what we do, and we're specialists in people's worst days of their lives. And EJ was having potentially the worst day of his life, and we were able to turn that around almost instantly. And so that was incredible to be part of.
I remember getting to her house and she's like, EJ had a little fall. I remember him coming out of the house and he was like stumbling. And I was like, that doesn't seem right. She goes, he wasn't like that an hour ago.
When EJ came in, he didn't have a normal color. He wasn't very awake. And so when it comes to brain injuries, you're talking seconds, not even minutes. And so we were able to mobilize our team and get him what he needed as quickly as possible.
It was one of those things where every minute counted, because they said if we brought him in any later, the results wouldn't have been what they were.
When I took care of EJ, I didn't have children and was still profound. And now that I have kids, it's just like, I can't even imagine. It's funny because you only see people when they're not doing okay. And to see him normal and standing and not recognizing him is that's like the best validation ever,
Over the last couple of years during this pandemic, I think the community has come to appreciate that The physicians, nurses, staff, and volunteers of Garnet Health are there for them. That we were able to provide the highest level of care despite extraordinary circumstances. And as we look forward with this emergency department expansion, I think it will only help us even further our mission of serving the communities of the Greater Hudson Valley.
We started this Every Minute Counts ED expansion fundraising endeavor before COVID-19 pandemic came to New York State. And we had been doing a lot of work on trying to reduce the overcrowding in the emergency department and having, individualized private care spaces for all our patients. We knew that our footprint wasn't big enough to serve the community.
Our goal has always been to ensure that patients are receiving effective care. We want to make sure that it's to the standard of care, and a patient's experience, how they feel, really affects how they perceive their medical care. Because the emergency room is expanding, they want to also understand that they're receiving exceptional care, that they're not just a number.
We will need your help to make this project a reality. Gifts large and small are needed and very much appreciated. Naming opportunities are available as well. Please make your gift today because every minute counts.